Okay, Dr. Schwartz, can you type into the message that you can hear us okay?
I can hear you.
Wonderful, thank you. We're going to start the meeting now.
Okay.
Good evening, and thank you for joining us on Zoom at Capital Health Regional Medical Center. My name is Sam Plummerai, and I'm the chairman of Capital Healthcare Corporation Board of Trustees. Thank you all for taking the time to be with us today. In accordance with state law, tonight's meeting was advertised in the August 19th editions of the Trenton Times and Trentonian newspapers and has been posted on N.J.S.A and capitalhealth.org since August the 12th. Also, in accordance with state law, we have posted our most recently audited financial statements online at capitalhealth.org. If you have trouble finding them, we are also sharing with you a link to these statements under the chat section of tonight's Zoom meeting. Tonight, you will hear about some of the things Capital Health is doing to meet the growing healthcare needs of our community. You will also hear about our financial well-being and organizational changes related to safety and quality. We will then turn the floor over to you for any questions that you have. Here at Capital Health, our commitment to Central New Jersey and Eastern Bucks County region is built on a foundation of innovative, patient, and family-centered care that is more than a century old. Even through the unprecedented circumstances we've all been facing in recent months, Capital Health always stands ready to provide care that you, our neighbors, can rely on. To provide care that is safe and convenient during the COVID-19 pandemic, Capital Health has been taking all necessary precautions across our service lines. Primary and specialty care providers in our medical group offered video visits to current and to new patients. Capital Health Living is a new program that provides seniors with the health care support they need, right here where we live. From transportation to assistance with scheduling appointments at Capital Health. We could not be more proud of our frontline staff who guided our hospitals through the toughest days of the pandemic. As the pandemic evolves, rest assured that those same heroes remain ready to address your healthcare needs here at Capital Health. We're also very proud of the work we've done or doing to help address some of the most pressing needs here in our region. Recently, Capital Health Regional Medical Center was named one of the only 9 hospitals in New Jersey to be a host site for the New Jersey Hospital-Based Violence Intervention Program. Starting with medical treatment at our Level 2 Trauma Center, this program helps connect victims of violence with the social services, counseling, and education they need to help break the cycle of violence in our community. Capital Health also launched its Pride initiative to ensure we provide a safe and inclusive environment for our LGBTQ patients, visitors, and employees. Our efforts recently earned us the LGBTQ Healthcare Equality Leader designation from the Human Rights Campaign Foundation. We continue to educate our community through free online health education events led by some of our talented staff right here at Capitol Health. Hosting these events virtually during the current pandemic allows us to safely share important information with you. At our Family Health Center on Bellevue Avenue in Trenton, we launched an $800,000 renovation project supported by efforts through our development office. Improvements include new elevator equipment, a new roof, a new high-efficiency boiler system, and a new parking lot with additional spaces and much better lighting. Our goal has always been to identify the most pressing needs of the community and develop programs to address them. Despite the challenges of the pandemic, our financial standing continues to be solid through the first half of 2020. This is great news for Hamilton Capitol Health, but it's better news for the people that we serve. As a nonprofit, all of our income goes back to the community through investments in staff, facilities, and technology. This allows us to continually advance medical care and develop new programs to meet your needs right here in your neighborhood. I again invite you to review our recently audited financial statements online at capitalhealth.org or by clicking on the link shared in this chat section of tonight's Zoom meeting. And now it's my pleasure to turn the floor over to Capitol Health's President and CEO, Al Magazine, to talk about some of the other highlights over the past year. Dr. Magazine.
Thank you, Sam. Good evening. As we navigate the ongoing pandemic, now more than ever, it's important for you to know that when you need us most, Capitol Health is here and ready to provide the best and safest care possible. To protect all of our patients from exposure to COVID-19, we're taking extraordinary measures that meet or exceed CDC guidelines, whether it's in the office, the emergency room, or inpatient units, or our hospital-based outpatient departments. We continue to affirm our role as a healthcare leader in the region with world-class clinical expertise and advanced technology. Last month, Capitol Health Medical Center, Hopeville, was designated a Center of Excellence in Robotic Surgery by Surgical Review Corporation. This accreditation shows that we meet the toughest quality and safety standards for minimally invasive robotic-assisted surgery. The center is led by surgeons with highly specialized expertise in surgical oncology, in colorectal surgery, urology, GYN oncology, thoracic surgery, and more. Here at Regional, we received the American Heart Association, American Stroke Association's Get to the Guidelines Gold Plus Quality Achievement Award. This speaks to our comprehensive stroke center's commitment to providing nationally recognized research-based treatment. Our Hopeville campus earned its third consecutive accreditation as a chest pain center from the American College of Cardiology, reaffirming our role as a leader in providing expert care for cardiac emergencies. Honors and initiatives like these are not possible without our highly trained and experienced physicians, nurses, and staff working to support them. As part of our partnership with Rothman Orthopedic Institute, Dr. John Abraham leads our sarcoma and orthopedic oncology program at Capitol Health Cancer Center, the only program of its kind in the region. Last year, our Cancer Center Director, Dr. Doria, became the first surgeon in the greater Philadelphia region to perform a robotic-assisted Whipple procedure to treat pancreatic cancer. And soon we'll welcome another doctor to our already talented team of radiation oncologists. Together, their efforts, alongside the rest of our talented team at Capitol Health Cancer Center, will continue to push the boundaries of innovation when it comes to finding and treating cancer. Our medical group continues to grow, both in talent and geography. New primary care offices have opened in Bordentown and Hamilton, New Jersey, along with the new Yardley location in Pennsylvania. A primary care office in Levittown will open later this year. In specialty care, we onboarded all of the largest OBGYN practices in our region and now manage offices in Bordentown, Browns Mills, Hamilton, and Pennington in New Jersey, and a Langhorne office in Pennsylvania. We welcome 3 new fellowship-trained rheumatologists to help meet an important need here in our community. Along with their office in Pennington, they will soon open new offices in nearby Newtown and Bordentown. Along with the growth of our medical group, we're expanding services at our new outpatient facility in Bordentown, which opened earlier this year. In addition to primary care and Rothman Orthopedic Institute offices, we'll also offer behavioral health, rheumatology, OBGYN, and other specialties, as well as outpatient services that are conveniently closer to the residents in Burlington County. All of our recent accomplishments demonstrate Capitol Health's commitment to providing quality health care close to home. And now we would like to turn the floor over to you, our guests, to see if you have any questions about Capitol Health.
Does anyone have any questions at this time? This is the last call. Does anyone have any questions or comments to make at this time? Thank you this evening for dialing in and participating. Have a good night.
Thank you.